My name is Celina Flocks Monaghan, and I am a second-year PhD research scholar at the Institute of Global Surgery. My PhD focuses on the feasibility and applicability of patient and family-centered care for pediatric surgery patients in Malawi at the Mercy James Center. My PhD has been funded by the U.S. Fulbright Commission. I am a Fulbright student here in Ireland, and it's also being funded by the RCSI STAR program. There's this notion of patient-centeredness that's becoming very popular, and patient-centeredness is a very sort of Western, high-income setting idea in hospitals and with care. It hasn't always been applied to surgery patients, and it hasn't really been applied in low-resource settings at all. So the aim of my study is to sort of understand the feasibility of using patient-centeredness and family-centeredness with pediatric surgery patients and their families in Malawi. So there was a 2021 study done that estimated that there's probably about 2 million children in Malawi that have an untreated surgical condition, whether that's a congenital anomaly or anything of that sort of area, but they're just not seeking the care. And there's been a large expansion of pediatric surgeons available, and there's a specialty care center now as well. So it just, there's maybe a space now to sort of understand, so we have these services available and we have this population that needs to access these services, so what is the gap there? What is facilitating them not coming, or what is enabling them to get there? There's been a couple of studies already about using family-centeredness and patient-centeredness, particularly with families and patients in Malawi, and they have looked into what the role is for the parents. And there is this want for parents from their side to be actively involved. And they say, okay, well, yes, I put my child's life in the hands of the surgeon, but I want to be able to be a part of that conversation. When there's ward rounds, I want to be able to stand there and be included in the circle in the ward round, and I want to be able to understand what's going to happen and that kind of thing. There's not necessarily time, there's not necessarily enough resources for the surgeons and all healthcare staff at any of these hospitals to do that, but there may be a way that you can change the communication that better suits the parents and what they want. I think it's important now because we often make space to just sort of understand access to care and barriers to access to care, but we don't always see the relevancy in low resource settings in particular about asking about the quality of that access to care, which may itself be a barrier, or it may be a facilitator, and understanding more so, okay, so you've gone to the hospital, your child's had the surgery, you've decided to have the surgery for your child, but what did you experience, and how actively involved were you? How did they speak to you at the hospital? Were you part of the decision making at the hospital? Did you understand in the long term what the outcome would be for that surgery?